So of all the physical ailments that could befall one, I think for me the one that is the most debilitating is a migraine or any really kind of headache at all. That's why we have Dr. Paula Warren here with the headache specialist. How are you?
Good, how are you?
Well, thanks for being here. So tell us a little bit, let's first start off with what is a headache? What's actually happening there?
So there are lots of different types of headaches, but one of the most common is migraine, and that's actually a neurological disorder, dysfunction in the brain, hyperstimulation basically. Migraines typically have unique features to them. Patients usually experience unilateral head pain. It can be both, but usually worse on one side. Throbbing pain, moderate to severe intensity, could have nausea and or vomiting, light or sound sensitivity, and usually it interferes with their life.
That's me. Well, I say that's me. You just mentioned a lot of things there. So they're not all me, but I'll tell you, the light sensitivity for me, especially in what I do, there are lots of lights all around all the time. And I predominantly work mostly during the day, and the sun is no help when it comes to those sensitivities. How would they know, aside from just kind of like those symptoms you just mentioned, how would they know if what they're having is just a normal headache, a stress-related headache, or if it's going into a migraine?
So a lot of times people will say headache. I would say the vast majority of headaches that aren't that bothersome to them are probably not migraine. Migraines are really going to grab their attention, and that's probably what they're going to show up to a doctor complaining about. The way to get a formal diagnosis is to see a physician or other healthcare provider who can see if you fit migraine criteria. But a lot of times it's just a difference in severity in some of those key features.
Well, tell us a little about your background. How long have you been doing this, and what made you want to jump into this side of medicine?
Yep, so I'm a neurologist by training, and I actually did my fellowship in neuro-oncology, so in brain tumors. And I think that a lot of patients, you know, when they have headaches, one of the first things they're worried about or scared about is, do I have a brain tumor? When I left the academic world, I was in private practice and really seeing predominantly headache patients, and decided that I really liked it and decided I wanted to focus on that. I actually also have migraines myself, so this is something that I've been dealing with for most of since teenage years.
Sure. And so if someone recognizes the fact that this is, like you mentioned, this headache has grabbed my attention, it is completely ruining my day, completely ruining a couple days, a week maybe, what's the next step aside from just like calling a doctor? When they finally call and make that appointment, what does that process look like?
So when they get in, whether that be to their primary care or to myself like a neurologist, so what we're really going to focus on is, do patients need treatment of these? The answer is usually yes, but that can come in two forms. They can get on prevention for treatment of migraines, or they could just maybe need acute treatment, so medicine that they use when they get a headache. And usually we use guidelines, kind of 4 to 6 headaches per month to guide us in making those decisions, but this is very individualized and not a one-size-fits-all.
I'll tell you, when I first started having some pretty strong headaches, I was getting these little lightning bolts that would go across my vision, and then it was like tunnel vision as well. And I was ruled out of migraines. Mine was just a vision thing. This was in like 11th grade, and I'm gonna date myself here. We were using overhead projectors. They don't use those anymore.
I use those too.
I don't think they do. But it was like seeing, you know, a print far away and then coming down here and writing up close, and the far away to the close would really trigger these massive headaches that were just really focused on my vision, that were really triggered by my vision.
Yes, some people can experience aura symptoms, and usually that's visual, but there can be other types of aura, and that typically precedes a migraine. Sometimes they can be independent of the head pain, but that can be seen in patients with migraine.
So when patients come in and they have, you can diagnose migraine. What kind of treatment? You mentioned medicines that you can take when you feel one coming on. I would imagine, I don't know that I've ever had a migraine, but you said, how do folks know? My sister gets them. She feels when it's coming. It's like folks can begin to understand that.
Right. A lot of people have even warning signs that the headache is coming, or sort of what we call a prodrome. Even before the migraine pain has started, they have symptoms of the migraine. Some people can identify that, some people cannot. But we like to treat as soon as you know it's coming, because it's better to stay ahead of the pain rather than getting behind it. Over-the-counter medicines can be used for treatment of a migraine. There are different prescription medications that can be used. A variety of prescription NSAIDs versus a class of medicines called triptans versus some of the newer medicines called CGRP targeted agents.
And are there medications, excuse me, are there medications that, patients can take on a daily basis that helps to eliminate this altogether, or helps to at least drastically reduce it altogether?
Yes, that would be if we're focused more on prevention for that patient. So the patients that are having either really severe debilitating headaches or potentially more like 4 to 6 per month and needing more to focus on prevention in addition to just taking something when the headache comes. There's a variety of preventative classes out there. Some of the older, more typical agents that we use come from classes of antidepressant medicines, blood pressure medicines, anti-seizure medicines, all kind of repurposed for migraine. There are medicines that can be injected now, so those are CGRP targeted medicines, there are oral CGRP targeted medicines, and there's Botox for prevention of chronic migraine.
No, we're not talking about Botox for prevention of chronic wrinkles.
No, unfortunately.
Completely different.
Completely different.
Same medication.
Same medication. It is Botox on botulinum toxin A. But from a medical standpoint, this is injected by a neurologist typically in a very specific migraine protocol. It's 155 units, 31 sites. Takes about 10, 12 minutes, and they're done every 3 months.
Would you say you've been doing this for a little while now? Would you say that from the time you began in this care practice to now, you're seeing an increase in diagnoses? Are there people having more headaches than before?
I would say that migraines in general are really common. About 1 in 6, 1 in 7 Americans will have headaches. I think that people are seeking treatment and they're not just thinking, oh, this is normal or this is my typical headache, and they're wanting to do more about it. And so I would say that that is on the uptick.
I will say, like, it only takes one really bad headache to just ruin the day, and then you have to like think about, is this going to happen again? So you're saying that 4 to 6 episode per month, per week?
Per month.
Per month. So whenever your patients are being treated, what are they saying on the back end of treatment? Is it helping? Is it like giving them the new lease on life that they're hoping for once they've recognize what it is and they're getting that treatment?
Yeah, I would think that, and what I have experienced is that most of my patients who we find a good treatment regimen for are really able to get back some of their lost time. So they're functioning better in their home, their work, their social environment. They're missing less days in those things, missing out on less activities, and they're really appreciative of that.
And they're not stressing out on when the next one's coming.
Right. So what you want is to have medicines that will prevent the headaches if needed, medicines to get rid of them when they happen, because they may still come, but you want a medicine that's going to work quickly, be very effective, and give you the least side effects possible. And we have a lot better options. Absolutely.
Listen, if you have any questions, if you're having that headache that is ruining the day, ruining the week, ruining the month, give Dr. Warren a call with a headache specialist. They're on Seaway Road in Gulfport, all the way down by Three Rivers. They'll be able to help you out. At least give them a call and find out what's going on. Dr. Warren, thanks so much.
Thank you.